Introduction: the most common neurological disease in dogs is idiopathic epilepsy, or IE, and approximately 1/3 of these dogs do not respond to anti-seizure medications. Currently, diagnosis of IE is based on ruling out other possible diseases, so it would be helpful to identify a biomarker for IE to better understand, diagnose, and treat it. Diffusion Tensor Imaging, or DTI, a type of magnetic resonance imaging, or MRI, is used in human medicine to detect microstructural biomarkers of epilepsy. Given the similarities between epilepsy in people and dogs, DTI should be investigated in veterinary medicine to see if it can detect microstructural white matter abnormalities in the brains of dogs with IE, and if it can differentiate between dogs that respond to anti-seizure medications and those that do not. By using DTI to understand the neurostructural abnormalities associated with IE and anti-seizure medication resistance, diagnostic and treatment approaches in veterinary medicine could be improved. Epilepsy is a common neurological disease in dogs, which reduces their quality of life and shortens their lifespan. In veterinary medicine, IE is diagnosed indirectly by excluding other possible diseases. Therefore, biomarkers to narrow down the diagnosis of IE would be clinically useful. DTI is used in human medicine to better understand brain connectivity and diseases affecting white matter, such as epilepsy. Epilepsy occurs naturally in both people and dogs, with strong similarities between the two species. Therefore, DTI may help detect microscopic neurostructural abnormalities in dogs that could support a diagnosis of IE and improve treatment plans. Additionally, DTI-detected abnormalities may explain why some dogs respond to anti-seizure medications while others do not, as differences have been reported in human clinical trials. The use of DTI to investigate white matter abnormalities in dogs with IE is still in early stages. This article will provide background information on epilepsy and DTI, and explore how DTI is used in human medicine, and how it could be applied in veterinary medicine. The main focus of this review is on canine IE, which is epilepsy with a known or suspected genetic influence, or unknown cause. In human medicine, IE is referred to as genetic epilepsy when genetics are known to play a role, and has a wider range of defined epilepsy types and syndromes, and veterinary medicine is working on developing syndrome specificity within IE. There are 3 tiers of confidence for diagnosing IE in dogs. Tier 1 is when a dog has 2 or more epileptic seizures at least 24 hours apart. Signs of epilepsy appear between approximately 6 months and 6 years of age. A neurological examination during interictal periods is normal, and baseline blood analysis and urinalysis are unremarkable. Tier 2 confidence is used when Tier 1 criteria are met and no underlying causes are detected using additional blood tests, urinalysis, bile acids tests, cerebrospinal fluid analysis, and MRI of the brain. Although standard MRI sequences for the epileptic canine brain are expected to be unremarkable, there are some reports of hippocampal atrophy or other qualitative or quantitative abnormalities. It is important to differentiate between post-seizure and interictal abnormalities. Post-seizure changes have shown a marked reduction to full resolution on follow-up MRIs, and are mainly localized to the piriform lobe, temporal lobe, cingulate gyrus, and hippocampus. Interictal parenchymal abnormalities are more common in older dogs with IE in regions like the frontal lobe, piriform lobe, and occipital lobe. Tier 3 diagnostic criteria include all criteria from Tier 2, plus evidence of seizure activity using electroencephalography, or EEG. While there is a standard protocol for electrode placement in human medicine, veterinary medicine is still working to verify electrode placement for adequate coverage of the superficial cortical layer in dogs. Even so, EEG data of an ictal event or interictal epileptogenic pattern still offers the highest level of confidence in diagnosing IE. This can be challenging because of the lower likelihood of capturing an ictal or interictal electrographic event in dogs with less frequent seizures. Having a microstructural marker that is not reliant on real-time events during neuroimaging would provide another method for diagnostic confirmation during interictal periods. While most individuals with IE respond to anti-seizure medications, about 25 to 35% of people and dogs have drug-resistant epilepsy. The International League Against Epilepsy defines drug-resistant epilepsy as the failure to reach seizure freedom using 2 or more anti-seizure medications. In veterinary medicine clinical trials, drug-resistant epilepsy is referred to as the inability to reduce seizure frequency by at least 50% using 2 or more anti-seizure medications. The more anti-seizure medications being taken, the higher the probability of experiencing unpleasant adverse effects. It can be more difficult to detect side effects in dogs than in people because veterinarians must rely on caregiver observations, behavioral signs, and physiological signs. One example of a polytherapy adverse effect that may go unnoticed in dogs versus people is cognitive dysfunction. While alternatives to polytherapy are being explored, treating and controlling drug-resistant epilepsy remains a significant challenge. Diffusion Tensor Imaging is an MRI sequence based on an algorithmic model. It incorporates data from diffusion-weighted images, or DWI, taken in multiple planes to form a three-dimensional image. The diffusivity of water molecules highlights structural connectivity patterns of large white matter tracts. Diffusion patterns in the brain are dependent on the density, permeability, and direction of axons, large molecules, and microstructures. Diffusion can be either isotropic or anisotropic. Isotropic diffusion is the movement of molecules in an outwards and spherical direction, in the absence of structural barriers. The mean magnitude of isotropic diffusion is measured using an apparent diffusion coefficient. The mean diffusivity is calculated using apparent diffusion coefficient values in 3 or more orthogonal directions. Higher values for these indices are related to increased extracellular space, less structural organization, and fewer axons. Anisotropic diffusion refers to the tracking of water molecules within and along densely packed axonal tracts, which is the parallel movement of water molecules. DTI uses the magnitudes of multiple apparent diffusion coefficient values in 3 or more planes to measure the proportion of fractional anisotropy, or FA, within a region of interest. A higher FA value indicates structural organization and a dense region of parallel axons. Dense regions of parallel axons make up large white matter tracts. Diffusion indices can be measured in segments of tracts, and whole brain white matter. Connectivity indices are used to structurally or functionally analyze networks. Quantitative information on network structure and function can be extracted from DTI using mathematical approaches, such as graph theoretical analysis and independent component analysis. Graph theoretical analysis highlights the strength, length, and type of connections being made between regions of the brain, and independent component analysis allows for the breakdown and buildup of spatio-temporal activity of each voxel. Both are useful for understanding brain connectivity and differentiating between normal and abnormal structure or function. Regardless of whether segments, tracts, whole brain white matter, or networks are used as regions of interest, each method has benefits and pitfalls. Segments of white matter tracts allow the selection of regions with lower levels of crossover but are limited by a smaller number of voxels. Conversely, thin slices on image acquisition with zero spacing between slices could be used to increase the number of voxels being selected. Crossover refers to fiber tracts going in different directions within the same voxel, and is inevitable when analyzing tracts and whole brain white matter. The overlap from crossing fibers makes it hard to visually differentiate tracts using FA maps, color orientation maps, and tractography. Because FA is a vector, and the magnitude of its value is dependent on direction, when tracts cross because they are going in different directions, FA values are cancelled out. Tracts and whole brain white matter can also be analyzed using tract-based spatial statistics, a reliable method for calculating accurate FA values. This method requires distorting, or transforming, each participant's brain images to fit a standard anatomical reference, which can be challenging and labor-intensive because of the varying skull morphology in dogs, but it is possible for mesocephalic dogs using a brain atlas space. Network measures account for the broad impact of epilepsy but may miss subtle nuances. Furthermore, functional connectivity measures are limited to resting state networks, such as the default mode network, in dogs as they almost always require anesthesia for MRI scans. Resting state networks refer to baseline connections between different functional regions of the brain. These networks highlight brain activity that does not require awareness to elicit measurable changes. However, it is possible that resting state networks are functionally altered by anesthesia. Study design in people with various types of epilepsy. There is a trend of decreased anisotropic diffusivity and increased isotropic diffusivity. In patients with generalized genetic epilepsy, or GG, decreased FA and increased mean diffusivity were found in the corpus callosum, corticospinal tract, superior and inferior longitudinal fasciculus, and supplementary motor areas. Similarly, patients with temporal lobe epilepsy, or TLE, had low FA and high perpendicular diffusivity, and additional measurement of isotropic diffusivity in the posterior corpus callosum, external capsule, internal capsule, and anterior corpus callosum. Temporal lobe epilepsy is a common form of focal epilepsy in people where activity originates in the temporal lobe. These results suggest that the white matter regions in those with generalized genetic epilepsy and temporal lobe epilepsy have more extracellular space and less dense axonal tracts. These studies demonstrate the widespread impact that GG and TLE can have on the brain, and support the idea that epilepsy involves structures outside of the epileptogenic zones. While white matter structures outside of epileptogenic zones show reduced FA in people with epilepsy, the closer to the epileptogenic zone, the larger the FA reduction. This means there tends to be lower FA in the hemisphere containing the epileptogenic zone. Similarly, individuals with TLE who experience generalized seizures have an ipsilateral reduction in FA in the hippocampal thalamic pathway. Another study found an increase in the apparent diffusion coefficient of the hippocampus located in the hemisphere that initiates seizure activity in those with IE. This suggests asymmetry between hemispheres is detectable and should be considered a potential variable in DTI studies of IE. It also suggests that the more brain regions are exposed to seizure activity, the more effects are seen, meaning seizure frequency should be considered a variable that influences brain microstructure. People with TLE and hippocampal sclerosis, TLE, and GG show a reduction in FA in multiple white matter regions, with the lowest FA values in those with TLE and hippocampal sclerosis. Hippocampal sclerosis refers to the loss of cells within the hippocampus. Age of onset and duration with epilepsy is negatively correlated with FA in people with TLE, but to a greater degree in those with TLE and hippocampal sclerosis. This suggests that the age of onset may influence the extent to which epilepsy changes the structural integrity of regions of white matter that are still developing. The progressive decrease in FA seen in those with TLE, in combination with the greater extent of damage and higher correlation between duration and FA reduction in patients with TLE and hippocampal sclerosis, could imply quantitative changes are detectable prior to visual detection of structural abnormalities in those with IE. Functional and structural connectivity abnormalities of neural networks are detected in people with IE. Functionally, a decrease in connectivity in the default mode network is reported in people with anti-seizure medication-resistant generalized IE when compared to healthy controls. Independent component analysis identified functional connectivity changes in people with juvenile myoclonic epilepsy, with enhanced connectivity between the prefrontal cortex and the motor cortex, as well as between the supplemental motor areas and lateral and caudal regions of the brain, and supplemental motor areas also showed a decrease in connectivity with rostral regions of the brain. Juvenile myoclonic epilepsy is a prominent IE syndrome in humans that shares parallels with juvenile myoclonic epilepsy in Rhodesian Ridgeback dogs. In terms of structural connectivity, there are differences in whole brain networks between people who respond well versus poorly to anti-seizure medications. People with newly diagnosed focal epilepsy, who had not yet taken anti-seizure medications, had DTI scans prior to determining if they were good responders or poor responders to anti-seizure medications. To meet the criteria for good responders, participants needed to become seizure-free for 6 months or more. The mean assortative coefficient, calculated using graph theoretical analysis, was positive for good responders and negative for poor responders. This means that good responders had more connections between similar brain regions and poor responders had more connections between dissimilar brain regions. This provides evidence of microstructural differences in white matter between people who respond versus resist anti-seizure medications. This body of literature exemplifies a wide range of abnormalities that can be detected using DTI in various presentations of epilepsy. Given the similarities between epilepsy in people and dogs, research from human medicine provides a methodological starting point for what should be explored in veterinary medicine. Conversely, the translational value of canine studies means that they can serve as a valuable source of insights for human medicine. People and dogs have similar neuroanatomy and share many aspects of epilepsy, such that each could be considered a model for the other. For example, because the proportion of those with drug-resistant epilepsy is similar in people and dogs, it is possible that the mechanisms responsible for drug resistance are similar between species. As DTI is a relatively new technique used to analyze connectivity within the brain, and most published research on DTI and epilepsy has been studied in people, trends from human medicine provide a framework for designing DTI studies for dogs with IE. There may also be limits to the transferability of data between human medicine and veterinary medicine. For example, there is a significant difference between the connectivity of the anterior cingulate cortex and posterior cingulate cortex when comparing neurotypical people and dogs. More specifically, the dogs had lower anisotropic diffusion between their anterior and posterior cingulate cortex. Epilepsy in people has been correlated with lower anisotropic diffusion in multiple white matter structures. Thus, using human medical literature to interpret canine data may result in inaccurate conclusions. Therefore, overall trends from human medicine should be considered, but actual FA values of regions of interest are not reliable measures to compare between the species. Results: epilepsy affects the microstructure and function of white matter tracts and influences the connectivity patterns within and between neuronal networks. Based on this, it is reasonable to use segments of tracts, whole brain white matter, or networks as regions of interest. Segments of white matter tracts investigated in people with IE include the corpus callosum, cingulum, external capsule, internal capsule, mammillothalamic tract, and hippocampus. Depending on breed, MRI quality, and software constraints, the external capsule and mammillothalamic tract may be too small for voxel selection in dogs. However, the corpus callosum, cingulum, internal capsule, and hippocampus are prominent structures that could be used as regions of interest for dogs. Whole tracts studied in people with IE that could be used as regions of interest in dogs include the corticospinal tracts, superior longitudinal fasciculi, inferior longitudinal fasciculi, and hippocampal thalamic pathway. In dogs, the corticospinal tract is hard to differentiate from the corticobulbar and corticopontine tracts, meaning these may need to be analyzed together. The default mode network and overall brain networks could be used as regions of interest when studying functional and structural connectivity. While other networks may be involved in epilepsy, such as the thalamocortical network or basal ganglia, these regions would require functional MRI techniques and unanesthetized dogs, making for a more complex experimental protocol and timeline. As DTI is a relatively new technique, only a few studies have demonstrated the feasibility of its use in a veterinary context. Extensive mapping of separate white matter tracts in healthy dogs using DTI has been verified with cadaveric dissections and anatomy textbooks, creating atlases. Such atlases could be used to compare tracts between healthy dogs and dogs with IE. Other atlases focused on parcellation of subcortical and cortical gray matter regions. While individual tracts and structures of white matter were not parcellated, segmentation of whole white matter was defined. Gray matter abnormalities are less of a focus in DTI, but a significant increase in apparent diffusion coefficient in the piriform lobes of dogs with IE has been reported. Meaning, parcellation of these gray matter regions could be useful for DTI research. Furthermore, identifying both gray and white matter abnormalities comes into play in regions like the hippocampus, a portion of the piriform lobe with a mixed composition of gray and white matter. In terms of whole brain white matter, at least one of these atlases are being used to standardize participants' brains for tract-based spatial statistics. An increase in isotropic diffusivity and decrease in anisotropic diffusivity in the hippocampus of people with TLE without hippocampal sclerosis provides evidence that quantitative imaging may precede visually recognizable structural abnormalities. Similarly, a study on dogs with IE found an increase in hippocampal atrophy, from 12 to 36%, when calculated visually versus using the hippocampal asymmetry ratio. Hippocampal atrophy is sometimes present on MRI scans in relation to IE, which is a discrepancy with Tier 2 diagnostic criteria stating that there are no structural brain abnormalities in dogs with IE. The hippocampal asymmetry ratio is dependent on volumetric measures. Therefore, other quantitative measures, such as diffusion indices, may also be sensitive to microstructural abnormalities in the brains of dogs with IE. Asymmetry between hemispheres may be a feature to explore in dogs with IE. Notably, a certain amount of FA asymmetry is to be expected in some regions, based on what is reported in people. For example, The left corticospinal tract tends to have higher FA than the right corticospinal tract in healthy people. The corticospinal tract has been reported as a region of interest for FA reduction in people with IE. Therefore, a thorough understanding of asymmetry in healthy individuals would need to be investigated prior to making any conclusions related to IE in dogs. The other route for studying microstructural and functional abnormalities in dogs with IE is to look at DTI-formulated probabilistic representations of neural networks. Graph theory analysis could be applied to DTIs in dogs with IE, using methodological frameworks published in Human Medicine, to investigate structural abnormalities of connectivity. Functionally, the anterior region of the default mode network in dogs with IE shows an increase in connectivity. This differed from a similar study in people with general IE. While these results are contradictory, it was theorized that there may be a compensatory increase in connectivity prior to degradation that occurs over the course of the disease. The same concept was discussed in a study that found an increase in FA in the frontal lobe of newly diagnosed and treatment-naive children with generalized IE. Only one article has looked at DTI in dogs with IE. The authors selected the corpus callosum and cingulate white matter as regions of interest, which have been found to have reduced FA in people with epilepsy. They reported a significant decrease in FA in the cingulate white matter of dogs with IE. Tract-based spatial statistics of this cingulate white matter did not show the same significant decrease in FA, which may be because tract-based spatial statistics does not highlight subtle microstructural differences. These findings could be expanded by using a larger population and additional regions of interest. Breed and age affect brain microstructure in canines, and sex and age affect brain microstructure in humans. Morphological variability exists between dog breeds, where specific behaviors correlate with structural differences in the brain. Moreover, human studies have shown differences in brain diffusion and connectivity between sexes. For example, one study reports that males have higher FA in multiple white matter regions when compared to females. Another large study found males have more intrahemispheric connections while females have more interhemispheric connections. In terms of age, neuronal degradation in people, which is reflected by a decrease in FA, generally starts in the anterior region of the brain and continues posteriorly. Therefore, age at skin may negatively correlate with FA in certain regions of the brain. A study on healthy mesenterocephalic dogs found a significant decrease in FA in multiple white matter regions, including the corpus callosum, in older dogs, aged 7 or older, when compared to younger dogs. Note: a decrease in FA in relation to age is not noticeable before the age of 30 in people, meaning a pattern may not be evident in a sample of mainly young dogs. Overall, breed, sex, and age should be considered when determining the relationship between white matter microstructure and IE in dogs. Volume is another factor to consider when studying IE in dogs. Volumetric data is simultaneously provided when selecting regions of interest from DTIs for diffusion analyses. A meta-analysis on structural abnormalities associated with generalized IE in people reported a statistically significant reduction in volume in the supplemental motor area, insula, thalamus, putamen, caudate, hippocampus, anterior cingulate cortex, and left pallidum. Also, the medial frontal gyrus was larger in the right hemisphere of those with generalized IE compared to controls. Furthermore, dogs with IE have a widespread reduction in cerebral cortical volume when compared to healthy controls. While volume of structures can vary between individuals, overall volumetric patterns and ratios are worth investigating. Discussion. The question of whether DTI is a viable resource for detecting microstructural white matter abnormalities in the brains of dogs with IE needs further investigation. Comparisons using DTI indices have yet to be conducted between dogs with IE that are responsive to anti-seizure medications and those that are resistant. A prospective case control cohort study design would be optimal for determining whether there are microstructural differences between healthy dogs with IE that are responsive to anti-seizure medications, and dogs with IE that are resistant to anti-seizure medications. Healthy dogs and dogs with newly diagnosed IE, who have not yet been treated with anti-seizure medications, could receive an initial scan and a follow-up scan 12 months later. During these 12 months, dogs with IE would be treated with anti-seizure medications and categorized as responsive or resistant, and diffusion indices and structural connectivity measures could be blindly analyzed. Comparisons could be made between neurotypical dogs and dogs with IE, between the initial scans of dogs that are resistant versus responsive to anti-seizure medications, and between and within arms over time to account for additional confounds and compare progressional changes in diffusion and connectivity of the brain. The first comparison controls for confounds such as breed, sex, and age. The second comparison would be useful for determining whether microstructures detected by DTI could be used as biomarkers to help predict anti-seizure medication resistance, which could help improve diagnoses and allow for more informed treatment planning. Structural connectivity has been compared between people who are good versus poor responders to anti-seizure medications. Assortative connectivity was associated with good responders and disassortative connectivity was associated with poor responders. With the similarities between human and canine epilepsy, these results may translate to dogs. The range of structural networks that have been explored using DTI in humans is vast, whereas the most practical functional networks to investigate in dogs with IE are resting state networks. In addition to network measures, anisotropic diffusivity and segmentations of tracts, or whole brain white matter could be investigated. Segments of tracts previously implicated in human IE that are translatable to dogs include the corpus callosum, cingulate gyrus, internal capsule, and hippocampus. Furthermore, tracts include the corticospinal, corticobulbar, and corticopontine tracts, the superior and inferior fasciculi, and hippocampal thalamic pathway. When investigating diffusion indices, it is important to use multiple measures to validate FA findings because the ratio of neurons going in the principal direction is being calculated, not overall density of fibers within a voxel. For instance, FA could be higher in an area with fewer parallel fibers than in an area with densely packed fibers going in multiple directions. Also, damaged white matter may not result in a change in FA if fibers in all directions are equally damaged, because the ratio between the fibers going in different directions would remain the same. Furthermore, histological findings suggest that apparent diffusion coefficient, an isotropic diffusion index, is a better measurement of myelination than FA, as FA measures myelination among other microstructural constraints of water diffusion. Different diffusion indices offer some overlap and some variation in information. Therefore, more detailed information can be obtained using multiple diffusion indices when studying IE. Asymmetry comparisons over time between hemispheres should also be made as differences have been seen in people and dogs with IE. This would provide information about the progression of changes in anti-seizure medication responsiveness versus resistance in patients. Also, it could act as a within-control measure to gain pilot data for future investigations on additional factors that are potentially influencing microstructural change, such as the number and type of anti-seizure medications being taken, seizure frequency, and seizure type. Research is building on evidence of microstructural abnormalities in dogs with IE from diffusion-weighted imaging, volumetric studies, and one DTI study. Functional abnormalities in the default mode network of dogs with IE have been identified. Further investigations will be needed into anisotropic diffusivity and structural connectivity measures in dogs with IE. While DTI is a useful tool to investigate brain abnormalities related to epilepsy in people, findings from human medicine are not always transferable to veterinary medicine. On this front, human medicine is ahead of veterinary medicine and provides a valuable framework to guide veterinary research. In turn, veterinary medicine may provide valuable information for human medicine. There are many types of regions of interest and measures that could be used, and each one comes with benefits and limitations. As well, confounds such as breed, age, sex, asymmetry, anti-seizure medication specifications and seizure or epilepsy type specifications would need to be considered. In tandem with other diagnostic techniques, discoveries using DTI could lead to more specific diagnoses and targeted treatments for dogs with IE. The article includes two figures. Figure 1 is a diffusion tensor image of a dog's brain, where tractography is used to predict fiber tract direction, which is represented by color. Figure 2 is an illustration of anisotropic and isotropic diffusion in selected regions of interest in the brain, where it shows anisotropic diffusion observed in the corpus callosum, where water molecules are restricted by dense axons and diffuse in a parallel and elongated fashion, and B shows isotropic diffusion observed in the lateral ventricle, where water molecules move in an outwards and spherical manner in the absence of structural barriers. The article does not contain any tables. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging,